Imagine opening your health insurance renewal letter and seeing the biggest price jump in more than a decade. Because that is exactly what millions of American families and workers are experiencing right now. Across employer plans, ACA marketplace plans, and small business coverage, healthcare costs in the United States are rising at their fastest pace in 15 years. This surge is being reported consistently by major outlets including the Washington Post, Reuters, the Financial Times, The Guardian, and new data from KFF, Mercer, and Aon. The trend is clear: higher premiums, higher deductibles, and heavier financial pressure on families who already feel stretched thin by rising costs across the economy. According to the latest KFF employer survey, the average annual premium for employer-sponsored family coverage has climbed to nearly $27,000, with workers now paying close to $7,000 out of pocket just for their share of the premium. Reuters reports that companies nationwide are being hit with projected premium increases of 6 to 10% for 2026, the largest jump in years. Aon's forecast goes even further, predicting a 9.5% rise in employer healthcare costs next year, driven heavily by soaring prescription drug prices and increased use of medical services. Many employers, especially small businesses, are responding by raising deductibles, restructuring benefits, or shifting more cost sharing onto employees. For workers, this means higher monthly payments, larger bills when they seek care, and more financial insecurity even when insured. The Affordable Care Act marketplace is facing an even more intense spike. The Washington Post and The Guardian report that many insurers have filed for double-digit rate hikes for 2026, with median increases around 15% and some filings exceeding 20%. A projection cited by The Guardian warns that ACA premiums could rise by an average of 26% next year, especially if enhanced federal subsidies expire. The Washington Post adds that new import tariffs on pharmaceuticals, combined with the skyrocketing cost of popular GLP-1 weight loss medications, are major contributors to the sharp premium increases being built into next year's rates. These GLP-1 drugs, including Wegovy and Ozempic, have become some of the costliest items for insurers, adding billions to healthcare spending nationwide. Financial Times reporting emphasizes that U.S. health insurance costs are now increasing faster than wages and broader inflation, creating a widening affordability gap that affects both middle-class and low-income households. As medical utilization rises, particularly in mental health and chronic disease management, insurers say they are simply adjusting rates to keep up with the higher demand and higher prices across the healthcare system. Time magazine notes that labor shortages in hospitals and clinics, along with rising provider costs, are also contributing factors. Low-income workers are being hit hardest. Many employer plans now require deductibles of $2,000 to $4,000 before coverage even begins, according to KFF data. For workers living paycheck to paycheck, these rising deductibles effectively make healthcare inaccessible. Several major outlets highlight that more Americans are delaying doctor visits, skipping medications, or avoiding necessary treatments due to rising out-of-pocket fees. Analysts warn that if costs continue rising at this pace, the U.S. could see increased uninsured rates in the coming years, especially among families who earn just above the ACA subsidy cutoff. This surge in health insurance costs is also becoming a national political issue. The Washington Post reports that policymakers face growing pressure to prevent massive premium spikes by renewing enhanced ACA subsidies and addressing pharmaceutical price inflation. Employers, meanwhile, are urging the government to intervene on drug pricing, warning that the current trajectory is unsustainable for both businesses and workers. Several experts quoted across Reuters, FT, and KFF warned that without major reforms, 2025 and 2026 may mark the beginning of a multi-year affordability crisis that forces painful choices onto millions of American families. In summary, the U.S. is entering one of its most challenging periods for healthcare affordability in over a decade. Verified reports from leading newspapers and research organizations all point to the same reality. Premiums are rising sharply, deductibles are climbing, drug costs are skyrocketing, and both employers and workers are under increasing strain. This is not a temporary spike. Experts warn it may be the start of a long-term shift in healthcare economics. For millions of Americans, the question is no longer whether healthcare is too expensive. The question is how much longer they can keep up.